Dr. Sunil Dialvis, the Deputy Director General of the ETR, also Dr. Dilantha Dharmagunawardana, Director Training, Dr. Lakshmi Kumar Tilaka, the Director MRI, and all other directors, consultants, principals, tutors, and all the MLT diplomats today, and their parents and family members, and all the distinguished guests, ladies and gentlemen. It is with much pleasure I attend this important event in the calendar of the School of Medical Lab Technology. 2017 Convocation for awarding certificates for diploma holders in medical lab technology. This is a very important step in achieving the school's mission statement with a message providing nationally and internationally accredited medical lab technology diplomates with social, sensitive and human qualities through education and training. MLT teaching programs have a long history in Sri Lanka, starting from 1959 with the establishment of the first MLT school at MRI, Colombo, followed by 3 more training schools at Colombo, Kalutara and Peradeniya, producing diploma in MLT qualified individuals for government hospitals. As we all know, laboratory testing is an integral part of patients' management. You all play an important, vital role in this process. It is one of the benefits patients under the public health service receive in our country. Recently, I took some initiatives to broad-base the program so that our patient need not seek the services of a third party for lab tests services. We are now in the process of buying autoanalyzers which can handle large volumes so that we get reliable, speedy reports. Actually, we started this program at the National Hospital, Colombo, where most of the lab tests were given to the private sector those days. Having such a large lab with all qualified MLPs, with all the equipment there. When I visited after becoming the minister, I asked why there are private labs or private hospitals are surrounded around the hospital, natural hospital. So they said that if they are given autoanalyzers, they can do all the lab tests. So I immediately provided the first autoanalyzer to National Hospital and banned sending lab reports outside the hospital. And in 2016, I got the money from the budget, 1.2 billion rupees, to supply auto and semi-auto analyzers to all the hospitals with lab facilities. So now from 2016-17 January, first I banned sending blood reports outside the hospital. So according to Ravi Kumudesh, the president of the Medical Association, he said the lab test in the government service has gone up by 50%. So that means the poor people are benefited today because all their tests can be done without the charge at their hospitals. Now we are performing almost all the key lab tests in government hospitals, and your service will be valuable to fulfill our government's target of minimizing the out-of-pocket expenses of patients seeking treatment at government hospitals. You have a very important role to play in this process, and the country expects you to serve the people with utmost dedication and commitment, as you pledge today. As we all know, the country is facing a growing trend in lifestyle diseases or non-communicable diseases like diabetes, hypertension, heart attacks, etc. On the other hand, we are facing an uphill task of combating chronic kidney disease. And accurate blood and urine reports are vital in identification and management of these patients. Diagnosis and treatment of communicable diseases of more recent manifestations such as dengue, various strains of influenza, drug-resistant and persistent TB, etc. heavily depends on reliable lab reports. As such, producing the critical pool of competent, efficient, ethically sound MLTs is one of the urgent needs of the hour. In this regard, I wish to thank Education, Training and Research Department, pathologists who engage in the evaluation, respective heads and directors of relevant training institutes, principals, and tutors of the three training schools for their tireless effort to uplift and upgrade MLT education in this country. I hope you will be pleased to learn that those who pass out as diploma holders now can upgrade their qualification to degree level at government university. You know, when I was a cabinet minister in the 2002 government, then there was a trade union actions by your leaders like Convocation and other people. They and the cabinet appointed a subcommittee under the present the Speaker of the Parliament, Haru Jayasuriya, the then Minister for Public Administration, myself and the Minister of Health, then Mr. Dara. Then I suggested to the PSN category, the Allied Sciences, right? Don't go and fight for rupees and cents. You can never get the equal status with other professions. Now you go for the degree, the graduate qualifications. Because when I was in the professional association for 8 years in the Expo, I was studying the various professional fields in other countries, especially in the developed countries like UK and US. They are all the MLPs, all the PSN people, all the nurses, they are degree holders. So they are called professionals. Because the main qualification to become a professional is to hold a degree or an equivalent qualification of a university. So without that, you will never be a professional. So to become a professional, so when you become a professional, even a medical or the dental surgeon is a professional. You also become a professional. So then that is how you get your equality, not otherwise. So then only they started this. So, and I am happy that when what I proposed at that time came to light, because when by the time they prepared their proposals and brought to us, and when we were implementing, that government was dissolved by the then president. So after that, when I became the minister, there were problems about by the so-called trade unions of the doctors against these degree programs. But I settled all the matters, and now actually we have the degree courses for all the nursing and the MLTs and all other PSN category. So therefore, actually you have a very good future, because when you have your degree, not only that you can serve this country, but you can serve any country in any part of the world. So that is why we are going to now, as the Minister of Health, now I have got the money to open the first university for nursing, the first faculty of nursing under University of Colombo. Now I think next month with the President, I will be laying the foundation stone for 19-story faculty for nursing and 13-story hostel facility for them. So that is then, and actually now with Ravi Kumadesh, we are going to start the next one is the other allied sciences for MLT, radiotherapy, physiotherapy and all those things. Another faculty and pharmacy and all those things. So that is, I have already discussed with the Vice Chancellor of Jayawardhanapura University and he agreed, and the UGC both agreed. Now I think Ravi has had discussions with the Vice Chancellor. So we will be, after laying the foundation, we will start work on the faculty of allied sciences, and where you all can become the graduates. And all these diplomates, if you are interested, you can go as the lateral entry and you can become a graduate, and we will allow the diplomats to gain the degree with the lateral entry to the faculty, and I think avoiding 1 or 2 years and get the degree. So therefore, the Health Ministry will soon provide opportunities for the diploma holders to undertake university degree programs under lateral entry. We will also soon grant diploma holders special leave to complete MLT degree course at the Open University. So I could see a gradual transformation of MLT service to a highly professional one with vast opportunities for specialized training. The benefit of this should pass to the patients of this country, and I am sure you will help my ministry in achieving these goals. In conclusion, and I must tell that before winding that in the faculty of nursing, we will be producing 2000 nurses. We will be training, a very big faculty. The same way I want to train about 2000 from your actually services also, your professions for degree courses. That is, I am training. We are giving a very good course in English with the British Council and expose you to not only to Sri Lanka but even to go abroad and earn your money and come back. In conclusion, I wish all the diploma holders passing out today a successful career and all the good luck. Thank you very much.